As the Obama administration and Democrats in Congress move closer to health care reform, major health care reform, it's not just health insurance companies that are taking note and trying to have their say. Property casualty independent insurance agents are also concerned. Bob Rusbult, President and CEO of the Independent Insurance Agents and Brokers of America, explains why.
Well, the message is really twofold. Number one is Congress is going to decide where we're regulated, how we're regulated, and who's going to regulate us. That's a fundamental issue for any business, let alone independent insurance agencies. So we want to make sure that whatever Congress does, that they do the right thing and that we help shape the future of our regulatory system. We happen to believe that regulatory arbitrage is not good for consumers. We believe that dual regulation is bad for independent agents, insurance companies, and our consumers. We believe that there are a host of issues on the table for independent agents. For instance, if you represent federally regulated insurance companies and state regulated, and you have claims issues with your clients, one of your clients may have 6 different insurance policies. Half of them may be regulated at the federal level, half may be regulated at the state level. Agents will have to become experts in 2 regulatory systems, not 1. So there are a lot of efficiency issues on the table. We want to make sure that we continue to have state regulation, but state regulation is improved. We need more uniformity in state regulation. We need more efficiency in state regulation. State regulation needs to be improved and modernized. The status quo is not acceptable to independent agents or our company partners. So that's issue number one. The second issue, Andy, is health insurance reform. Independent agents have an increasing part of their book of business is health insurance. It's one of the fastest growing parts of their book of business, employee benefits in general. If that is taken off the table and independent agents are no longer the distribution force for health insurance, that will be a huge hit for independent insurance agents. So we want to make sure we inform Congress and educate Congress the value that we add for our corporate and individual clients. Almost all the group insurance, mid-market group insurance, small group insurance, even larger, is written through independent agents. And we want to make sure that Congress doesn't do anything that removes us from the system and removes that value that we believe we add for the customer. President Obama ran on a very clear agenda in health care reform. And that includes everything from an insurance exchange to possibly a government option. And my concern is that if we have a government option in health care reform, over a very short period of time, it will crowd out the private sector. There's no way that private insurance companies are going to be able to compete with the United States government for a host of reasons that you don't have time for me to talk about.
The concern for the Big I and property casualty insurance agents is that depending on the direction that healthcare reform legislation finally takes, it could end up squeezing out those property and casualty agents who do provide group insurance to their customers.
Obviously, if private insurance companies are no longer part of the equation, that means independent insurance agents are not going to be part of the equation as well. So I have very serious concerns about the direction healthcare reform is going. The final chapter has not been written yet, but we're getting close to that. And my major concern from a process perspective now is the budget that the president is about to sign is going to include reconciliation, an inside the beltway term, but it means the filibuster is taken out of the equation. You need 51 votes in the Senate, and that means that pretty much healthcare reform is going to follow what the Obama administration wants. As I said, I'm not giving up hope, and nor should independent agents or insurance companies, but we have a lot of work to do between now and September.